Jason.
And then debating
Okay.
whether or not updated.
Yeah.
So,
I don't like, we had home had a match and I liked that. I'm going to call the meeting to order.
the only one I have a right now is that I'm down.
Yeah.
I'm not, I don't know what. to do.
Wednesday, April sixth. And
Just
I
gives
will
me jerks.
roll call it
Time.
Dick
That's
Cooter?
what-
Yeah.
They will know. I'm sorry.
Dick Cooter.
Yeah.
I need a gavel.
I'll bring you one.
It's
Okay.
2:01 and I felt meeting to order. And I'm taking roll call. So Dick Cooter,
Present.
Dr. Copeland,
Present.
Dr. Gorski,
Present.
Dr. Giardini,
Present.
Tim Neighbors,
Present.
Linda Sandquist, present. Lindy Larson Bennett.
Present.
We have 2 advisory members, Jay Ware and Jeanette Thomas. And also Marianne Abadi, present. And I'd like to also welcome Jason Holcomb.
Thank you.
And Chelsea Klutz. Thank you. I appreciate that. And moving on to the agenda of public comment, and
We had somebody that signed up for public
Right.
comment, but he is not present here today, so we'll
move on. Okay. And we had no requests for presentations today. So moving on to the monthly activity report. Jason, do you
Yeah.
want to
Sure, and I can
summarize?
pull it up here on the screen. We did not print out packets for everyone to save on paper, and you can just pull them up here. But a few things I want to highlight without going through everything. You'll see in front of you today a annual report that was completed and published. We printed off copies for each one of you, so I want to highlight that, but also thank Chelsea for really conducting that and completing that and making it really look really nice. So good job, Chelsea, on that. We've previously emailed a copy to the chairman, but we printed, chairman of the county board, we've also printed off an additional copy. Tim, I don't know if you want to maybe deliver that to him at a board meeting, or if we could drop that off at the county administration offices, either way. I'll also highlight just a few conversations and presentations we've had as part of our membership of ACMI, which is the Association of Community Mental Health Authorities of Illinois. We have, that network has felt disengaged from the statewide conversation about 988. You will recall that a presentation was given by Joan Lodge the last time we met. And while Joan seems to be getting some information as a member of that statewide task force, the mental health authorities across the state do not feel that they are in the communication loop about the numerous decisions that are being made at the state level about 988, about the implications of the CESA Act that was passed, and how all of these things will affect local jurisdictions, law enforcement, 911 services, et cetera. So we have, as part of ACMI, formed a community of practice that will work to both share learning and knowledge across the different mental health authorities across the state, many of whom are funding co-response type services, so that we can all learn from one another, but also so that we can bring a collective voice to the state about what's working and what are the issues from a community level that need to be addressed at a state level, and kind of hold accountable to there being some sort of feedback.
Jason, if I can just mention, it seems like Scott Block is also sort of in that 988 group based on the last meeting with Marlena, and I'm just wondering.
You know, Scott Block was the former executive director of McHenry County, and he was the former president of ACMI when he was serving in that role. So I know he has a very friendly relationship with ACMI. I know that Scott's work currently seems to be focused on doing sequential intercept mapping and that's an important component of this, but the 988 has a sense of urgency to it because it's supposed to be implemented July 1st, and there's still no communication coming to any local authorities about what that's going to be. So certainly Scott will be one of those many stakeholders, I think, that we would seek communication from, but I don't think that his sequential intercept map process seems to be answering the question either.
Okay.
And my participation thus far, at least.
Yeah, I just know it was mentioned. That's
We also had the kind of great fortune and privilege to present to a number of community stakeholders at, over the last month, including Rockford Urban Ministries, who kindly hosted a community event for us and at a local church building and invited people to participate both online and in person. So we were able to go tell about our process and the funded programs. Tim came with me that night along with Jeanette Towns, and we presented and did a little bit of kind of a question and answer following that, and there was a great response from that. The following morning, I went to the Chamber of Commerce Government Affairs and gave the same presentation, and that also had great response. There were many members of the business community who stayed after 20 to 30 minutes after the presentation to talk about the impact of this in our community and how I guess inspiring and encouraging it was to hear that just after 2 years, there's some tangible results of that tax implementation. Really great response. And then that Saturday, so this was all within 72 hours, I think we had 3 presentations. We actually presented to a group of young leaders, high school students, about 20, who show up on Saturday mornings as part of a community foundation in Youth We Trust committee to talk about funding. And the cool thing about this group was through their own surveying of the needs in Winnebago County and the region, they discovered that the #1 need for youth in our community right now is mental health. And so they determined, independent of anything we're doing, to focus their In Youth We Trust grants this particular time strictly on mental health. So it was really fun to talk to them about our process as a way of kind of just giving them some ideas for how they implement their funding for their mental health process. Really, really inspiring, honestly, to see on a Saturday morning, 20 high schoolers show up to make an impact in their community.
Question.
Yeah.
Funding, they are receiving funding or
In
they're a
Youth We-
conduit for funds?
Yeah,
or?
In Youth We Trust is an established program at Community Foundation through which donors can give funding to that committee, and then a youth committee decides who actually gets the funding through a grant process.
What kind of magnitude is that?
It's pretty small scale right now. I don't remember the exact number, but it's definitely in the thousands, not the hundreds of thousands.
It's great.
Yeah. And then lastly, there is a organization in Chicago that I've been familiar with for maybe the last 5 years or so, ever since I went to a collective impact convening conference several years ago. And their work over the years, they started doing impact investing, and they've kind of transitioned to a much stronger focus themselves on mental health, being one of the funders actually of the Chicago co-response program. They also are kind of have taken more of national leadership on talking about how to do community engaged planning processes and community engaged participatory evaluation of programs. And so they are recently partnering with some leaders in the funding world that include MacArthur Foundation and the Grand Victoria Foundation, and the 3 of them have kind of together partnered to do some research on what's called abundance, an abundance movement of trying to recognize how to fund more organizations led by people of color, and to create more integrated service delivery systems that don't inadvertently create segregated delivery service systems. And so without there being any particular specific intention around this, what they have offered, I recently reached out to them to ask about some of their work, and they, through conversation, were very interested in things in our community and the work of the mental health board, and we're willing to host a conversation in Chicago should anyone from our community be interested, not anyone in our community, but should the anyone of our organization be interested to spend some time just learning about their work as a best practice potentially.
No, interesting.
Yeah, okay, yeah. Okay, well, I will communicate to them there'd be at least some interest, and then we can see where that evolves, and I'll send out any potential logistic information of what that might entail. All right,
Okay,
to the action items.
right. and say moving
A lot of
to the
updates this month. We had a short meeting, so I went a little overboard.
Yeah, I'm glad. Very informative. Thank you, Jason. I will need a motion to approve the minutes from the March 2nd, 2022 meeting. So moved.
Second.
Okay.
Bill,
There were a lot of seconds. So. Okay, so we have a motion to approve in a second. So bring any discussion, any changes? Hearing none, we will bring this to a vote. All those in favor of approving the minutes from March 2nd, 2022, say aye.
Aye.
Okay, meeting minutes approved for March 2022. Moving on to our second action item, special conditions met, and I'm gonna let Jason summarize for us.
Sure. The special condition was for the Winnebago County Sheriff's Office, their special condition number 4, that they develop a customer satisfaction measurement tool. And they have now developed that for, upon approval for implementation, a patient satisfaction survey. I have to say, I'm kind of impressed that, with it for the, for it being a jail and the limitations that they have with what type of feedback they can realistically get. I'd have to say, I think they went above and beyond on this for making sure that they were getting informative feedback from inmates about knowing what resources and services are available in the jail.
And I would also like to concur that I really feel like this consumer satisfaction or consumer feedback is so critical. And to get it from the jail population is on mental health issues, in terms of medications. And I think these questions were so clear and concise. There just would not be misunderstanding or misinterpretation. So I applaud them for doing this. So we will need a motion to approve the special conditions.
Also,
second.
Second, Dick Kuhn. Hearing, we have a first and a second motion. So any other discussion about the survey? Question? Sure.
When is it administered?
It's a good
What's the
question.
timing of when?
Well, it has to be after the service, when they've been there, but how long?
Right.
I'm not sure.
At what point in their journey? through the
Sure.
System with this.
I do not know the details on that, I'll be honest with you. Yeah.
well, I think that's probably pretty crucial because this is a very transient population, So you might have gotten mental health services
Is it?
and then you
just-
found out. And if we haven't get, so I would,
Yeah, and to be honest, Sergeant Pont may have communicated that in an email to me. But I would have to double check on that. I would imagine it likely is at the time of discharge. But I apologize, I don't know that answer off the top.
He deserves an attaboy for what it is that he's doing with this. Yeah,
As long as they receive it, that's all that matters, that actually can.
I can say they've been so open to our feedback that I have no doubt that
Right.
what they would certainly heed our recommendation about implementation, and I know that they go out of their way to look at best practices across what other communities are doing, and really, so I would imagine that whatever the timing is for that, that it's been well informed by best practice, and would also be open to our input if we had a specific time that we thought was most necessary to implement.
So any other questions, comments? Okay, bringing this to a vote. All those in favor of approving the special, or not, this, what was?
Yeah, it's a
Yeah,
special
it was a
condition.
special, not the survey. Say aye.
Aye.
Moving on to the third and final action item is a resolution authorizing the board to renew for the renewal grants for the program year 22 to 23. So we do need a motion to move that forward.
So moved.
Second.
Any discussion about this at all?
I'm just curious how the rankings and comments came out based on,
For the renewal applications, everything was from 100% to 94%, which is very high scoring. Overall, that indicates almost perfect compliance in every category. Or I say, and our scoring was highly compliant in every category. And 80% would be considered between moderately and highly compliant, to give you some context. So 94, 95%, that's well above the threshold on those.
Met criteria.
I just want to comment in my own reviewing the applications and so on. I felt like everybody was trying to meet the goals and objectives that, had started out, but they were being thwarted by circumstance, the absence of personnel and the ability to hire personnel and blah, blah, blah. So it was hard to get a sense of ultimately, are these programs going to be viable long-term? I just sort of want to qualify this by my own feeling, which is next year I expect high compliance early on in the program, because I think there are now at the end of the first year, they get, they've gotten the running start now. Now I expect some real results. So with that.
There were limitations with COVID and the labor market and all sorts of areas that were very significantly impacted, starting for many of these agencies, and just getting the facility ready for a new expanded program is also time limited. So we have a first and a second motion to approve. And so any other comment or question at this time? If not,
Maybe I'll make one comment for the record that
Okay.
all of these programs were funded at the full amount that they requested, aside from the co-responder program. The one thing that was omitted from the co-responder was the equipment expense, which was for vehicles. I did have a conversation with the grant manager for City of Rockford, and he was going to speak with their finance department to see how that equipment expense was previously awarded in last year's grant. So they are going to work with us to try to get that in the funding for last year's already awarded program amount. And should there be any reason why they cannot get that by May 31st, legal counsel did advise that there could be some potential options for contract extension based on the special circumstances that there were supply chain crisis issues that kept them, it may have kept them from meeting that expense. But otherwise, aside from that one thing, everything else is being renewed in full at the amount that was requested.
So what if, let's say, May 31st, they don't have their vehicles. Now we have I don't remember the amount, X dollars from last year's budget unexpended. Was that pour over into this year's budget?
Well, if we extend a contract, then that could.
No, I'm saying, let's say we don't extend the contract, they haven't fulfilled that, they still want that, and we have that extra money, can we simply shift that to this coming program?
Well, I think that would be maybe a question, a bigger question about all of the programs.
Right.
Yeah, exactly.
Right, we don't anticipate this.
Okay, all right.
Because there would be, it's unlikely that in an expenditure-based grant that every program will spend
Right.
100% of
Right.
what they're awarded.
Right.
Doesn't seem too highly controversial if they haven't been able to find it to extend the previous year's funding to accommodate the capital expense. It wouldn't seem to me.
Right.
But then thank you for your attention to this, and removed it from this year's.
Right,
Yeah, that's good.
rather than refunding.
Well, wait, as long as we're talking about this. So let's say X program doesn't spend all their money, does that just pour over into?
Based on the contract, what they do not spend is not given to them. So they're basically getting reimbursed for expenses already, right,
Right,
expended during the program year, so it just stays in the mental health fund.
okay, so it just
But it
raises the
doesn't-
amount in our fund
It doesn't necessarily roll over to them, it just
Right.
rolls over
to
to
us.
us. Yeah.
Okay, just, we'll bring this to a vote, authorizing the resolution that the Winnebago County Mental Health Board funding and allocation of grant funds for renewal applications for program year 2022 to 2023 will be approved. All those in favor?
This is money, don't we have to go individually?
Let's do roll call vote on that.
Yeah, because it's money.
It's resolution.
Do we do roll call for money?
Yeah,
I thought we were present, we didn't, but,
Well,
Certain
let's just do it for
certain
the record.
things require a roll call.
pardon me?
Just even if you're present, certain things require. a roll
Okay,
call.
so we do roll call, okay? I will be happy to do roll call. Richard Coon,
yes,
Dr. Copeland,
Yes.
Dr. Gorski.
Yes.
Dr. Jardine,
yes,
Kim Neighbors,
Yes.
Linda Sandquist,
Yes.
Wendy Larson Bennett,
Yes.
Mary Ann Abad, yes. Okay. So moving on to discussion items, at this point I have none on the agenda. Moving further down to other matters, I, at this point, was going to inform the board that, there was public comment the last meeting, I believe, or maybe 2 meetings ago, regarding a request for addresses for private practitioners from the state, actually asking, and what the public comment was Harlan Johnson requesting the board to submit a request to the governor's office to be able to obtain these addresses and contact information for private practitioners. And I did, and he was representing the Trauma and Forum Committee from the Winnebago County, Winnebago County Public Health Department. And I did have a conversation with Dr. Martell, and actually the committee was not requesting this information. So I just wanted to inform the board that it wasn't a committee as a whole. It was an individual doing so. So just to bring that information back to you. And other than that, we have the adjournment.
yeah.
I got a question, like on next year's request, like the renewals, can we get the amount of what was total
Sure.
spent in the process? You know, this year's renewals, I didn't see what was, I saw what was requested and what was granted, but not what was actually spent.
yeah, it was kind of difficult to do that in a uniform way this year because people are at different points in their reimbursement requests, trying to get their financial departments to basically submit the paperwork in a way that's systematic enough for us to process it and do it to the county. So, and answer your question, yes, next year we will be able to provide that in a way where you see the entire first program year, what was actually awarded and what percentage of that was spent. So that can help inform decisions for next year based on maybe should something be renewed, but also should it be renewed at the amount that it's being requested.
But it says under section 1 under the resolution, that total there, is that not what would be spent on the grants from last year?
So that's next year.
That's what's being awarded for, that's what's being awarded or allotted, but as an expenditure-based grant process, they're basically being approved for up to that amount based on approved expenses.
Okay.
So
Yes, I see.
if they have a month where there's a staff that's down, it's hard to make that up in a
Okay.
different way.
I
right? So you
understand.
just kind of lose that month in a way.
Mhm.
Other mental health boards, just for, if you're thinking of other funding models, you have expenditure-based grants, that's one type of funding. You can do pay for performance. Dr. Gorski might be a little more familiar with that. I know Centers for Medicaid and Medicare at one point did that through some of their innovation funding through the Obama administration. Personally, the things I've read on it, I think it's kind of more complex than what it was intended to be, because it's supposed to simplify matters and say, if you meet the deliverables or the objectives, you get paid lump sums amounts, and you don't have to go and manage all of these expense reimbursement requests and invoices and receipts and time logs. I think how it's played out in reality, it just puts the complexity on the outcomes part of it and determining what actually is performance and how's that measured. So I don't know that's removed the complexity, it's just shifted it from one part to a different part. And the other part of the other type of funding that I know other mental health boards have used would be fee for service, where essentially you're offering for the same rate that Medicaid reimburses for to be used for somebody who's not insured.
Right.
Again, it's an option, but I don't know that when we're doing a community support system, that's kind of narrows the focus into clinical services and not
Yes,
the full array of
Right,
services.
exactly.
Not what we want to.
And I'm particularly struck with programs this year that are requesting more money, more resources for that very thing, which is more, somebody who's overseeing what's going on, somebody who's monitoring the whole system of care.
So I think
Or portions of it.
where the limitation of the expenditure-based grant is that you're never gonna get to 100% of what you award. And we
Yes.
may just at some point in the future need to understand that and award more than what we want to spend in a particular year. Would be I think the solution for that problem.
Because, as years go on, that could continue to fail. As that reality becomes evident, and I think it'll become even more evident as time goes on. The other thing that struck me, just if we're conversing about observations, is that, there's a number of incredibly important things that are being funded that, but for our funding, I'm not sure they could exist at all into the future. So I think, you made a point earlier, Wendy, about first 2 years, that the third year, some other things will become more evident, which is, are there certain areas that will rely on the stream of funding? I don't want to use the word forever,
Yeah, but
but in perpetuity, that we can find
Right.
it, because otherwise there is no revenue. It's not a
Right.
revenue generating program, but it's deemed to create great value.
Necessary.
So, how that gets filtered into the filters in subsequent years, I think will be very interesting, important, challenging at the same time.
And I think we talked about the fact that we had a couple programs this year that without the initial funding, they could not have hired the staff, begun the program. And then once they did, it's almost self-sustaining right away because they're able to build.
Generally,
And,
right.
right, and they're generating revenue, but without that foundation, that could never have gotten off the ground. So, I mean, we can't, eventually, we may have more programs like that. And we hope to,
Yeah,
in a sense, because of the sustainability factor. That's what we look for, that we don't want to be in a position of funding forever.
Well, the other piece of it is that there's a huge population of people who probably could get services if the right puzzle pieces were in place. And what I see a lot of our programming doing is helping people get the right pieces in lockstep so that then, oh, now I have Medicaid, or now I have Obamacare, whatever it is. It's like, oh, bye, we don't need your money anymore. But there's always going to be a stream of people who need those puzzle assemblies going on. So, anyway.
I think Bill's point, as the system matures, those are the kind of things that we're going to see. They'll be, because people will, the pathways to help will become clearer. And we should then be able to kind of create priorities for certain kinds of both services and providers who are doing the creative things of making sure that our services are open to everybody within the community and all parts of the community. So that's where I think we have to go with our memorandums of unity that we want to see within our array of services. I mean, so for example, kids services right now, we certainly have increased access to kids services. We really don't, to Wendy's point, we don't know yet on who's going to access them and how broad it's going to be within our community.
I still get the feeling that when everything ultimately over years falls through the scepter, there will still be some that there will be no billable revenue for.
Oh,
Right.
without a doubt.
Absolutely.
That was kind of,
Absolutely.
but your point, Mary, I think over time, and I did this last year, I did it this year, and I frankly enjoyed it because you get to learn about the programs and you learn about the process. But you can see that becoming a little clearer that there are some, as you say, well, over time, hire the staff to be able to bill. They're billing either governmental payers or they're billing third-party payers. Their need from us should diminish, and then there's others that there will really never be.
Exactly, and that's the
Opportunity.
balance right there, that,
Well, but even as our vision continues to crystallize, clarify, I guess when I think about what we're doing, what I think about is a world in which a child is born and a family has a support system, whether internal or external or some mix, that enables that child to develop a healthy personality, to be capable of engaging in good education, to have a family that has adequate financial resources, to support the family. And when things fall apart, there's enough support in the community to help them pull their lives back together, so that 30 years from now, we have a more healthy, functional community. 30 years ago, when I started practicing law in juvenile court, it was during the crack baby epidemic. And I remember a caseworker saying to me, right now we have grandparents who are able to raise these babies in large part. Can you imagine what's going to happen when the grandparents of these babies are the crack in? Now what's going to happen? And they were saying, 15 or 20 years, the lid is going to blow off. And part of me looking around, I'm thinking, not only is there no internal family support available? But at the same time, our community resources were falling apart. And I'm hoping that what we're doing is reconstructing them.
Well, I know we are.
Yeah, that's what it feels like.
Yeah, it really does. One final comment, Jason, did you share with the board the email from Crusader Clinic? Because I think that was a great example of the impact immediately that our funding for the enhancement of their embedded social worker and primary care had. And do you want to summarize that a little bit? Because
Sure, I think that's an important illustration as well. I was kind of thinking the same thing as everyone was talking, that the things that we're measuring on a program by program level don't capture some of the organizational shifts that occur by the community having this funding. And I think some of that, I really think will be measured when we come back to our 3-year plan update and we redo that environmental scan and see what changes to the system have occurred. But with Crusader, the shift that took place for their organization was from essentially as an FQHC, a federally qualified health center, their reimbursement only allows for a licensed clinical social worker. So that's the only type of, my understanding was that that's the only type of mental health provider that they could hire
and services limited.
and get reimbursed through their traditional funding mechanisms. With the mental health funding for their new program, they were able to essentially create not only provide a more services that are embedded with their primary care and also their immediate care, which in itself is innovative, but then also create their own internal kind of career development pipeline where they're now bringing in interns, and then some of those interns can turn into employees who they can support as employees as they achieve their credentialed license, licensure that will allow them to go through the traditional funding model. So that's an innovation that is only allowed by a local fund and only would have happened, through this mental health funding. But it's not just the service delivery that's impacted, it's been the culture and the shift within the organization. And they talked about the impact that that's had within their organization of now having young, energetic interns who are in school kind of working in tandem with their professional medical staff.
So it was, they really are very grateful to have had the funding, yes.
I was gonna say that's gonna also help with the shortage of staff that we have as they grow through that program. And
Absolutely.
other programs need that staff that they're short on,
That's right.
and they won't have to leave the community.
Right.
Right,
Yeah.
and it takes time to supervise these interns, and without the funding, they would not have been able to, free up the time with the professionals. So all in all, they're just very grateful and wrote a very generous.
And the other point to where the system is, to Wendy's point. So with the doula program connected to Crusader Clinic, which is, I think, Bill, right? They handle more pregnancies and more births.
Well, midwives do dual
Yes,
Yeah. But I mean, the combination that's going on with the doulas and Crusader is the start of like what Wendy was outlining in terms of working all the way from infants all the way through. Up,
Even
up.
prior to birth.
Exactly, no, exactly. So our capacity to kind of promote health just improved 100%. So.
Well, and we tend to look at sort of, disadvantaged people and families as like the crisis focus of our services right now. But down the road, I'm hoping we can expand more, because it's not just disadvantaged families that suffer from mental health and substance abuse problems. And it's easy for people to get sort of, isolated in their little pods, and having a broader reach can give a better community landscape for everybody, so.
But I think that our targeted population, it doesn't matter disadvantage or advantage. It's people that have serious mental illness that, generally don't get the care they need by going to a psychiatrist once a week. So that's the reason that,
They don't have access.
yes,
Correct.
to that record. Okay.
I make
moving
a
on.
motion to adjourn.
Thank you. I need a second.
Could we
Tim.
could we have discussion before the? I have one logistic.
Oh,
yeah.
go right ahead. Let's do it.
Did I hear that, it's a personal thing, but I can look ahead several months and know that I won't physically be in town for maybe a meeting or something. Did I hear that we're allowed to have a virtual option as long as the majority is in person?
So I will get clarification on the specific rules for that, but my understanding from Attorney Quantz's last instruction to us was that once we went to in-person, the only option for participating virtually would be based on a medical consideration, and that the board would have to vote at the beginning of the meeting to let that person participate virtually. Tim, I don't know, is that consistent with how the county board is currently operating?
They had to develop a ordinance in their meeting status to allow for a medical employment and something else. We created an ordinance that allows, but it still has to be a majority of the board members present in person. But it just gave us more leeway to allow for us to be absent. So work-related, medical, is the third one. I can't remember exactly which one
Okay.
it is.
One of the things that did not get accomplished for this month was the policy and procedures document that the legal counsel was going to develop. I think I distracted them with a number of grant-related questions over the last month. So I will, maybe among all of the other things we've previously discussed, ask them if they could clarify that point with us, and ask them if that needs to be memorialized in the policies and procedures document with the specific conditions for which virtual attendance is allowed.
So we have vacation, grandchildren, other than. I'm just thinking, right?
So via YouTube, all you can do is watch.
That's
and
correct.
raise your hand.
Or vote, I assume.
You can.
Right. So that would become, the point of clarity would be important for all of us, I think, at some point in time.
Sure.
Yeah, technology allows for us to do a hybrid meeting, right, where you can participate fully virtually while everybody else is in person and vote and do all those things. There's not a technology limitation, it's more of a statutory.
Yep, got it.
Which maybe hasn't caught up yet.
I think that's
Yeah,
exactly it.
correct. That's pre-COVID.
Yeah.
Is there going to ever be an opportunity for us to, I guess we have to publicly discuss the other applications? They're just, so it's at the next board meeting.
There will be conversations that I will schedule with each of you to discuss them, but then for full board discussion, it would be at the board.
Any other comments before I bring the adjournment to a vote?
We don't have a second yet.
Yeah, we did.
So-
We have a first and a second
Silent but
motion
deep.
for adjournment. All those in favor? please say
Aye.
Meeting adjourned.
Okay.
It's always so hard.
Thank you.
Nice seeing everybody in person.
Yeah. I've seen it.
It is 2:40.